And so it's just that simple way of saying that thought is allowed to be there, that thought can be true, but I'm just going to take a little step back from it and see it for what it is, which is a thought. A thought is just a string of words. It doesn't have to have power over me. It doesn't have to impact on what I'm doing. I'm the lead nurse in London for the complex NF1 service, and I've been working with NF1 for 11 years now. It is a privilege to work with a condition that is constantly changing and evolving in our understanding, and I hope you're inspired a bit by the research that is going on internationally about the condition. So one of the problems that we deal with this condition is pain. So I spend a lot of time talking to people who are in pain and the challenges that faces. So I'm going to cover a little bit about, what is pain, how we think about pain, and then the different types of treatment strategies. So first question, if I was to ask you what is pain, what are some words that might come to mind? Ow. Yeah, exactly. Ow. And the others? Discomfort. Ouch. Hurt. Yeah. Are we thinking like physical pain? Depressing. Yeah. It's depressing, disappointing, heartbreaking, maybe. Limiting. Yeah. Upsetting. Exactly. So I think what you're already bringing out is what the international team of pain experts have said as well, which is that pain it's an unpleasant sensory and emotional experience. And I think that's a really important thing that we need to think about when we're addressing pain, is it's a sensation, it's a physical sensation, but it's also an emotional sensation. And you can't separate those two things. So when we're thinking about how we manage pain, we need to be keeping in mind that it's a physical sensation and it's an emotional sensation. It's both at the same time. And the other thing that's really key is that it's experienced based on actual or potential damage. So what does that mean? It means that sometimes we can have pain because there has been physical damage, but sometimes we can experience pain because we're expecting a potential damage, but then find out, actually, no, it's not that bad. So, purpose of pain. If I said to people, would you like to have a life that is completely free from pain, you never experience pain, would anyone say, yes, I would like that? Yeah. Yeah, because we're like, I don't want pain in my life. Absolutely. But unfortunately, there are some people who have a condition where they don't feel pain, and they get a lot of problems, because if you can't feel pain, you can't tell when something is too hot, when something's damaging you, when you need to move away from something that's unhealthy for you. So pain actually does have a purpose. There's a reason we experience pain. So some of these purposes are up here. So, pain protects us. So if we've got an injury, we experience pain, and then we know, I need to stop doing that thing that's injuring me. So it protects us. It alerts us. It's like our body's alarm system to say something's not right, and also pain remembers. So it's really important, as we're growing, when we're children and we experience pain because maybe we've, touched a hot oven when we shouldn't, even though our parents tells us not to, and we've done it, but we will then remember, don't do that again because that's really painful. So pain is linked with memory. And so it's us then learning from our experiences so that we then don't put ourselves in potential dangerous situations again. So pain is unfortunately really important. But a lot of that, of what its purpose is around acute pain. So acute pain is pain that happens due to maybe an incident that happens, something very short-lived, So I'll use the example of, when I was young, I fell over and I broke my ankle. So that is an example of acute pain. Suddenly there was damage, my bone was broken. And so, that was a real problem, and I had the pain was that alarm system saying, don't move it, you need to stop because you're in pain. So just thinking about I won't say a break, we'll say if I twisted my ankle, what might be some strategies that you would use to manage that pain? Yeah, so I'm hearing rest, I'm hearing ice. Yep, you're going to bandage it so it can't move. Yep, you're going to take some painkillers. What painkillers might I take? Yep, some paracetamol, ibuprofen. If it's really bad, I might take codeine or morphine and be off my trolley. But so I'm gonna. These are all strategies for acute pain. Right, something's happened. These are all great strategies for less than 3 months. Right, and so acute pain, we class it as long as it's less than 3 months. It's acute pain. And those kind of strategies of resting it, keeping it up so that it heals, maybe you're going to elevate it, keep it bandaged. All of that are really good strategies for less than 3 months. But if something lasts for longer than 3 months, we class that as chronic pain. And chronic pain, regardless of what causes it, is a condition in its own right. And so because of that, we have our own specialists, we have pain management, pain consultants, who've specialised in chronic pain. Regardless of what has caused the pain, it gets treated as its own condition. So it's longer than 3 months, and sometimes it cannot be easily explained, which can be quite tricky. If you've been in pain for longer than 3 months, it's not getting better. And there might, as John was talking about earlier, a lot of people that we speak to who have NF1 have pain that's been going longer than 3 months. And despite all the different investigations that we've gone through, we might not be able to find a structural abnormality, a structural reason to explain the pain. And as John said, that doesn't mean the pain's not there. It just means that we can't then find a particular way of treating it, of getting rid of it. So sometimes people are experiencing pain because they've got a neurofibroma sitting on a nerve that's pressing on the nerve, and that's causing the pain. And sometimes, we are able to remove those lumps and, thankfully the pressure's then off the nerve and the pain goes away. Unfortunately, with NF, often, even with surgery, it doesn't make the pain go away. And that's why, working with your team who's looking after you, it is a partnership. We need to make these decisions together of what's going to be the best solution in the long run. And as John said as well, if there are neurofibromas that are inoperable, sometimes they are going to be painful, and so then we need to try and manage that pain. We can't take the lump away for whatever reason, it's too dangerous. And so that's why we then need to think about how can we manage the symptoms that the lump causes. And as John said, really important, if you have a lump that becomes incredibly painful, is growing rapidly, you're noticing any change in your function, so the nerve that it's sitting on, you might experience some weakness, numbness, pins and needles or tingling that is new for you, then please get in contact either with your doctor. If you're under one of the complex NF teams, please tell us. If you're not, then please get in contact with the helpline, and they can help make sure that you're getting listened to by your GP. So how do we treat chronic pain? Like I said, it is a different disease in and of itself. And some of the things that we've said before that work for acute pain, unfortunately, don't work very well when you've got chronic pain. So, for example, what were the things that we said before? We were going to rest it. So resting over 3 months' time, for example, I sprained my ankle. For some reason, it's now 3 months on, it's still painful. My MRI shows everything's fine, but I'm still in pain. Resting it after 3 months, unfortunately, is going to actually start doing more damage to my body because I'm going to get deconditioned. I'm not going to be able to be as strong and as mobile. So I need to think about a different strategy for managing that pain. Same with, we mentioned about different painkillers that you can take, like ibuprofen, paracetamol, codeine. Over 3 months of use, these medications really aren't good for you. And in fact, you start getting other problems. You might start getting analgesia overuse headaches. Taking paracetamol, all of that every day can actually cause headaches. Taking codeine, morphine for a long time can cause constipation. So then you might be getting back pain. So these kind of medications, they're really not great for long-term use. And that's why when we think about chronic pain, we need to think about it as its own condition. And because of that, we have different types of medications and different strategies that we need to think about. The strategies that we use for acute pain aren't going to work well for chronic pain. So many ways to manage. We've got, obviously depends on how intense the pain is and what the pain does to your quality of life. So for some people, they'll say, oh, yeah, I get like daily headaches, but you know what? I just kind of push through. I'm still able to go to work. And so they might use some of the self-management strategies. Where for some people, they might say, well, actually, I'm able to kind of get through my day-to-day, but I can't sleep because of the pain. And in which case, they might use some of the kind of self-management strategies, maybe some mindfulness at night to help them sleep. But they might also then try a nerve-specific painkiller to help with their sleep. So it's about working with the person of like, okay, how is this pain impacting your day-to-day life? And how can we then address that specific issue so that you're still able to get on and make the most of your day-to-day? And we're just going to cover through the medications, physiotherapy, psychology, and surgery. So firstly, self-management. There are loads of free online resources about pain. And they're really helpful. They explain about chronic pain. They explain different strategies to help. So some of my favourites, the Physiotherapy Pain Association has a massive list about all different resources with lots of links that you can click on. They're really great. Pain Toolkit, Flipping Pain, and Retrain Pain. Great names. Again, they all have like little resources, bite-sized resources that you can use to try and understand pain and manage your pain yourself. Medications. So like I said, the acute medications that we might use, they're not great for long-term use, and especially if your pain is being caused by a neurofibroma, pressing on a nerve. That nerve pain, paracetamol is not going to touch it, is it? So you might, if you'd like to, if you want to yell out maybe some medications that are for nerve pain. Oh, I heard amitriptyline, gabapentin, pregabalin. There we go. That's our triple threat right there. They are the main ones that we will go to. So nerve painkillers, they work very differently to acute painkillers. So where, you might have, say I'm using headaches a lot. Say you might have a headache. You're like, oh, I'm in pain. Take some paracetamol. Hopefully in half an hour it feels a bit better, right? But the nerve painkillers, they don't work like that. Instead, what you want is a continuous level of the drug in your body at the right level for you. And that can take a while to get right. So, for example, I'm using headaches again. There's a lot of people with NF1 have headaches. If you are saying, oh, actually, I get migraine every single day and I'm taking paracetamol and ibuprofen every single day, we go, well, actually, we know that that's going to make your headaches worse. That's not ideal, is it? So instead, we might try you on amitriptyline, which is a headache preventer, which you then take every day. So, and usually at nighttime. So that one, it takes a good 2 to 3 weeks before it starts kicking in. And unfortunately, the 2 to 3 weeks is usually when you have the side effects worse. So a lot of people will come to me and say, oh, Mary, I tried amitriptyline. It didn't work. I tried it for 2 nights. And I'm going to go, yes, unfortunately, it's not going to work for 2 nights. These are long-term medications. We need to commit. Please try them for at least a month and just give it a go. And unfortunately, some of the side effects, people really won't get on well with them. Common side effects are that you might feel quite drowsy or sleepy. So if you are starting them, please start them when you're not having to go to work the next day. If you can maybe do it over a weekend to kick them off. So you might feel a bit spacey, a bit drowsy. Some people get a bit of a dry mouth. And some people, unfortunately, experience some weight gain as well. So with these medications, we'll start you on a very low dose and start them for a couple of days. And then if you tolerate that well, then we increase it a little bit. If you tolerate that well, we'll increase it a little bit more. It's a slow progression. And again, it's working with you of what's going to work for your body. Because for some people, they'll be able to take really high doses, not many side effects at all, and they're fine. Where other people will come at the starting dose and, that's it. They have to stay on the starting dose. And that's fine because everybody's different, So it's about trying to find what's going to work for you. But it is a much more long-term, thought process of, committing to it, giving it a real go for over a month, and then seeing how you get on. And unfortunately, sometimes we do have to try several of them before we find the one that's going to work well for you. So it's a very different way of thinking about medication, and also really important that you are then also taking it consistently. So it is, if you're on amitriptyline, that's every night. You need to be taking it every night. If you're on pregabalin, it's usually twice a day, and then gabapentin 3 times a day. So, it is a big commitment. But if you think about, if you're taking paracetamol every 6 hours and we're then offering you something that you just have to take at night, there's benefit there, isn't it? It's less medication that you need to be taking. Lovely. So physiotherapy, I know some people, when we say, oh, I see you're in pain, would you like to come meet our NF physio? You might think that that's a bit strange, but why is physio really important? Well, as I mentioned already, when you're in pain, you might start trying to guard that area that's in pain, and that over a long time can cause problems because your muscles are going to get less strong. The more you move, then you're going to have more pain. And for some people with NF, you might have joint hypermobility. So we got really flexible joints. And when you have really flexible joints, you can then experience joint pain. So working with a physio to be able to build up the muscles around your joints can protect them and reduce your pain. But why else is physio really important? Well, we also know that, if you have stronger muscles, they have a higher pain tolerance. So overall, we want you to experience a higher pain tolerance. When you have pain that, we can't fix, we can't get rid of, these are ways that we can support you. And also, as John was saying before, with bones, with bone health, for NF1, you have slightly softer bones. It's really important that you are exercising regularly to have as strong bones as well. We want to be the healthiest as possible for as long as possible. Now, psychology. I know some people, when we start trying to explain, that they might want to meet our NF psychologist when we're talking about pain, can be quite resistant to it. And that's why it's so important that we mention it and we understand why the psychologist is part of our team. It's because we know that when you are in chronic pain, it's going to impact your mood. You know, it gets you down. I think someone said it's really disheartening, it's disappointing, it can be depressing, especially if we're saying, actually, you know, we can't remove the problem, we can't get rid of the pain. You know, that's going to eventually affect your mood. So when we mention psychology, it is 100% not because we're saying it's all in your head and we don't believe you're in pain and anything like that. Please hear us. That's not what we're saying. We're saying that if you are in pain and you are not able to do all the things that you want to do that give your life value and meaning, you know, you're not able to be playing with your kids the way you used to, or you're not able to go to work like you used to, you know, that is going to impact your mood. And we know that if your mood is low, your experience of pain is going to increase. So, you know, if you think about like all these different layers that impact pain, your mood is one of those layers. And so that's why we want to address that as well. You know, yes, we can try pain medication. Yes, we can try physio. But it's really important that we're addressing your mood and your beliefs around pain as well. I hope that all makes sense and you all think we don't think you're crazy. It's important. And that's because this is my lovely little diagram. So why the psychologists are important, I'm not going to get out of the frame. So the psychologists are going to think about your thoughts, because your thoughts are going to affect your behaviours. They're going to affect your emotions, how you're feeling about things, and they're also going to impact on your physical sensation of pain. So all of those things are interlinked. Remember, if you go back to the original definition of pain, it was about the physical sensation and the emotional sensation. They're linked. And so that's why it's so important that we have a psychologist in our team, because she wants to support people with the thoughts that they're having about the pain, because those thoughts lead to behaviours which impact on your emotions and impact on your physical sensations. I've gone backwards. There we go. So some of those strategies you might have heard of before. There are two main strategies that we use for pain management. And the first one is cognitive behaviour therapy. I don't know if anyone's heard of that one before, CBT. So what cognitive behaviour therapy says is your thoughts impact your behaviour, impacts, you know, how you're living your life, how you're interacting with people. So if we can look at your thoughts and challenge maybe some of the unhelpful thoughts that you're having and help you replace those thoughts with different thoughts, that might help then change your behaviours. It might help, you know, change your interactions with other people, your interactions with the world, so that you can then be more healthy and be more involved. So that's cognitive behaviour therapy. A slightly newer, I think, approach to psychology is ACT. It's acceptance and commitment therapy. And ACT is used more, I think, in pain management. I know our pain management team at the hospital that I work at, their group sessions are ACT-based. And that's because they're saying, well, actually, you know, if someone's in pain, we can't just challenge a thought because the pain's still going to be there. You know, if you say, oh, I'm not going to walk down to the shops because I'll be in pain, you know, cognitive behaviour therapy is not really going to work because you can't challenge that thought. That thought is true. You know, if you walk to the shop, you probably will be in pain. So instead, acceptance and commitment therapy says, okay, those thoughts are allowed to be there because, you know, that thought is true. But that thought doesn't have to take over your life. It doesn't have to stop you doing what you want to do. You can say those thoughts are allowed to be there, but let's look at what you value and what's important to you, and how can we support you to have thoughts that then help you to engage with the things that you really value and that you really want to do in spite of being in pain. And so one of their techniques they use is called diffusion. So when we have a thought, if we believe that thought and we fuse with that thought, so for example, the thought that if I leave my house, I'm going to be in pain. So then I'm not going to leave my house. So instead they say, okay, if you fused with that thought, you're then probably not going to get up and leave your house. But if we can use some diffusion techniques, so pull you apart from your thought, then you might be able to actually challenge that thought. So some of those techniques are things like just very simple of saying, I notice I'm having the thought that if I leave my house, I'll be in pain. So instantly you're taking a step back from that thought. And you might still, by doing that, say, well, I do believe that that's true, but it is really important that I leave my house. So I'm going to do it even though it's going to be painful. And so it's just that simple way of saying that thought is allowed to be there, that thought can be true, but I'm just going to take a little step back from it and see it for what it is, which is a thought. A thought is just a string of words. It doesn't have to have power over me. It doesn't have to impact on what I'm doing. And so that's how ACT can be quite helpful for pain management. And then mindfulness, which we're going to do a little technique at the end. So mindfulness is about being present in our body. And if we get caught up in our thoughts, especially at night time, if you're struggling to sleep, if you've got very active thoughts, then mindfulness can be very helpful of centering yourself back into your body, and focusing on your breathing, focusing on the sensations of your body, and that can help slow those thoughts down. So pain management programs around the UK, there are some NHS pain management programs. We're very fortunate at Guy's and St Thomas's to have one, where this is for people who have chronic pain, who maybe have tried many different medications and it really hasn't worked, where they will come and actually have a couple of weeks where they'll stay at the hospital, and every day they'll have input from pain nurses, doctors, physios, psychologists in a group setting. And that can be really effective to help people how they think about pain, and how they let the pain impact on their life. So lots of different resources for you as well. Feel free to take a photo if you'd like to. And we are going to do a mindfulness exercise. So has anyone done mindfulness before? Yes, okay, so you all know what is coming. So I want everyone sitting as comfortably as possible, preferably with your feet on the floor. And if you feel comfortable, you can shut your eyes. You are allowed to fall asleep. This is your permission to fall asleep. This is why they give me the slot after lunch, because everyone's already sleepy. So we're just going to do a very short exercise of mindfulness, of being in our body. So let's begin. So the first step is to become aware. So check that you are sitting with a relaxed but upright posture. And we're all sitting relaxed and upright. And this process may be easier if you close your eyes, and you can close your eyes if you wish. If you are doing this exercise in your day-to-day life, you might not want to shut your eyes, but it will depend on the situation. And it does help you to connect with the experience most fully. Now, bring your attention to your inner experience. Gently bring your awareness to what you are experiencing. Ask yourself, what am I experiencing now, right at this moment? Gently draw your attention to any thoughts going through your mind and try to watch and observe these thoughts. For example, you may say something to yourself like, I am aware of anxious thoughts, or whatever the thoughts are for you. Whatever the thoughts are for you, try to accept them as just mental processes. Thoughts are simply happening without trying to change them or getting hooked into them. Draw your attention to any feelings that you are experiencing. Whatever these feelings are, even if they are unpleasant or uncomfortable, perhaps saying to yourself something like, oh, I'm aware now that I feel sad or angry, or whatever the feeling is for you. Simply try to accept and acknowledge these feelings just as they are, without trying to change them. Now gently draw your attention to any sensations in your body. Scan your body and notice any sensations. Pleasant, unpleasant. Any sense of tension or discomfort. Just acknowledge these sensations without trying to change them. Perhaps saying to yourself, that's interesting. I'm feeling a tightness in my shoulders. Or whatever the sensation is for you. Just acknowledge these sensations without trying to change them. Now gently move your focus to your breathing. Really focus on your breath. The sensations of your breathing. The sensations of the breath from when it enters your nose, when you start to breathe in, until you breathe out. Become aware of your breath traveling through your body. The sensations, the movements of your abdomen and chest. If your mind wanders from the breath, gently bring your attention back to the breath. Use your breath to anchor you in this present moment. Now expand your awareness to include your breath and a sense of your total body, all aspects of it. Notice that it is as if your whole body is being breathed, is breathing softly, gently. If any feelings or sensations of tension or discomfort emerge, imagine your breath moving in and around those sensations, accepting and embracing them, gently exploring them without trying to change them. When their presence becomes less noticeable for you, gently and softly bring your awareness back to your total experience in the present moment, to your body, your thoughts, the environment. And now, with your eyes open, sitting here in the present moment. How are we feeling? So that is a mindfulness activity and is very useful if you are struggling to get to sleep at night. And that is my talk on pain management and mindfulness. Thank you, everyone.